How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melendi, and this is Disruptive Dialogue. Hello, Disruptors. How's everybody doing today? Today's episode's a little different. I'm going to kind of be a newscaster. I'm going to share with you what's been happening over the past month. And I dare say it, but I think the tide may be turning. So for years, as I've talked to y'all in past podcasts, the role of the health insurer, the pharmacy benefit manager, other middlemen in the U.S. healthcare system have kind of stayed in the shadows. People did not realize how big they were growing, how powerful they were growing, what they were doing. You go see your doc, you get upset, you get mad at the doctor. Drugs are expensive, you get mad at the drug manufacturers. Little did we know that over the last 10 to 15 years, some of these pharmacy benefit managers and health insurance companies have become some of the biggest companies in the entire world, not just the U.S., the world. When you have companies like UnitedHealth Group, last year alone made $400 billion. And Aetna, which merged with CVS, Caremark, making $380 billion or $357 billion. Those two companies alone made more than the 5 largest drug manufacturers in the world. So these Goliaths, who are supposed to be the guardians of the healthcare system, negotiating with hospitals and providers and the government and drug manufacturers to lower costs. Look, that doesn't happen because they are publicly traded companies and they report to shareholders. So a lot of stuff's been happening, and I just wanted to get on the podcast and give you a quick version of what's going on, because this is what I do almost full time now, and you all have your busy jobs, so you get to hear the, what do we used to call that? The Cliff Notes version of what's happening. So look, 5-7 years ago, most members of Congress and other legislators, like in the states, they didn't even know what a PBM was or what it stood for. And as you all know, if you've listened, PBMs stand for pharmacy benefit managers. However, a lot of organizations, both patient advocacy organizations, physician medical societies, even drug manufacturers, advocacy organizations have been screaming that, hey, health insurers, PBMs, they're reducing access to care and they're raising the cost of healthcare. Well, now you've got legislators paying attention. There are a ton of bills being presented, laws being passed. Hell, the Federal Trade Commission, the FTC, whose mission is to protect the public from deceptive or unfair business practices, they did an investigation of PBMs, and I'm going to quote it. The FTC report released in January found that over the past few years, the 3 biggest PBMs, CVS Health Caremark, Cigna's Express Scripts, and UnitedHealth Group's Optum RX, they inflated the cost of numerous life-saving medications by billions, with a B, billions of dollars. Now, these companies countered, saying the FTC's report was misleading and apples and oranges. Look, every investigation that comes out, they say that, and it's ridiculous. But at the end of the day, these findings are exposing that these organizations are monopolistic. They've gotten too large, and there are lawsuits and investigations all over the place. And that's what I'm here today, is to share some of those things that you know what's going on. The first one that was crazy, and I read it through this organization or this newsletter called HR News, BlackRock. Now, BlackRock, most of y'all know, is one of the most powerful and largest asset managers in the world. It's like private equity. They are UnitedHealth Group's biggest shareholder. In the last month, it came out that they are suing UnitedHealth Group. They're suing them as a shareholder. Here's what it's all about. And I quote the news source, HR News. The lawsuit's twisted premise is that after CEO Brian Thompson of UnitedHealth Care got murdered and the whole country started screaming about claim denials, United got spooked. Word is they've been approving more treatments, covering more procedures, and maybe even acting like an actual insurance company instead of a denial machine. Well, BlackRock doesn't like that. The lawsuit from BlackRock alleges that UnitedHealth misled investors by not being clear about how all the negative publicity might make them, actually honor their insurance contracts. Because apparently their CEO got shot for denying cancer treatment. And the logical response would be maybe stop denying so many cancer treatments. But that would cut into profits and BlackRock's value goes down. So BlackRock came back out and said, look, this report is material, false and misleading, and we don't really agree with what people are saying. At the end of the day, the group is seeking unspecified damages, arguing that the public backlash prevented the company from pursuing, quote, the aggressive anti-consumer tactics that it would need to achieve its earnings goals. This gets to the root of the problem in healthcare in the U.S. Shareholders for an insurance company are suing them because their financial results are disappointing. They're not suing them and upset because of patient care. They weren't cared about all the denials. They weren't cared about the increase in costs for healthcare, putting Americans into bankruptcy, putting employers at a disadvantage to companies who are outside the U.S. with a more reasonably cost healthcare system. They're not care about people avoiding care because they can't afford it. They're pissed because the revenues and profits aren't hitting what they hoped they would. Nope, the lawsuit levied against United is because they didn't share with them that the profits and revenues might drop because they may actually work on their public image by acting like a health insurance company is supposed to act, which is to provide services that your customers had paid for. So that was crazy, and I had so many people send me that I had to share it with you. Another one, and this is another sad situation. I don't think it's rare, but there is a lawsuit. 22-year-old Cole Schmidnick. He tried to refill his inhaler that was prescribed by his doctor to prevent his asthma attacks. This medication he'd been getting that was on the formulary of his PBM was $70, was now being priced at over $500. Cole's father said they couldn't afford it, so Cole left the pharmacy with only a rescue inhaler, which is only used for quick relief. But that type of medication by and of itself isn't strong enough to help someone out in an emergency room if the attack is severe, per Dr. David Bernstein. 5 days later, after that script wasn't filled because the price went from $70 to $500, Cole had a severe asthma attack, stopped breathing, and collapsed. He never regained consciousness and died. The doctors attributed his death to asthma. His parents blame what they say is a dysfunctional system where medications can change in price overnight and without notice. And, this is a part of the insurance system that Americans don't know real well and was responsible for the spike in Cole's inhaler price. PBMs. They are the middlemen that control behind the scenes which drugs will be on insurance formulary, which ones are covered, and how much it will cost you. So Cole's parents are pushing for legislation that would require a 90-day warning when an insurance company's formulary is going to change. Shocker, we have to sue to have a law that if you're going to change medications that could be keeping people alive, you have to give them a 90-day notice. But they are suing Optum Rx, which is the PBM for United, that took Cole's inhaler off their formulary, and Walgreens, his pharmacy, that didn't offer Cole a different alternative that could have prevented that type of attack. More bad news for the insurers. As reported by MarketWatch, the Centers for Medicare and Medicaid Services, also known by everybody as CMS, has launched a significant expansion of its audit program of the Medicare Advantage plans that are out there in this country. This is so exciting. They have literally, CMS is expanding from just 40 auditors, just 40, that's ridiculous for the country, to 2,000 employees to do this work. And there's a reason. There appears to be a direct response to long-standing concerns both by patient and consumer advocates that the private Medicare Advantage insurers have been massively overbilling taxpayers. Now think about it. There's bills out there right now that are contemplating going after Medicaid and Medicaid fraud. I haven't gotten into Medicaid, but I will tell you right now, the majority of Medicaid fraud is by types of providers and people billing Medicaid, not by patients, regardless of what you hear in the media. They don't need to go there if they want to pay for these tax cuts. The government estimates that the Medicare Advantage plans may be overpaid by as much as $43 billion a year. And there are outside reports telling that those overpayments might be even higher than $43 billion a year. You want to save money for this budget? Go after the Medicare Advantage plans. They're doing a thing called upcoding, and it is a serious issue. Medicare Advantage plans are expected, this is crazy, to see a payment increase of over 10% this year compared to traditional Medicare, due only to upcoding alone. So understand this, traditional Medicare is through the government, run by the government. Medicare Advantage is Medicare paid by the government to private companies like United, Humana, Cigna, Aetna, for them to run Medicare. What they're finding is that these Medicare Advantage companies, the Uniteds, Humanas of the world, are upcoding. So what do you mean by that? Well, first off, another congressional advisory group called MedPAC, and they're like a watchdog. They expect that over the next decade, if we do not reel in upcoding, it could lead to Medicare overpaying Medicare Advantage plans by over $600 billion. That is basically $60 billion a year. You want to fix our budget? That's a good place to start. I will tell you, if you don't listen to podcasts, well, hopefully you do, you're listening to mine, but there's a podcast from the Wall Street Journal. They have a 3-part series called Medicare Inc. It is awesome. I'm learning so much from them. And basically what they did was they did investigative reporting for some time, Medicare Advantage plans, going to some nurses and physicians that work for these private payers. And a new study shows to the extent to which the biggest player in the business, United, stands out from the rest. Now, let's be serious here. United is the biggest insurer, so more than likely they're going to bring in the most money. But right now, they pulled in an estimated $33 billion in additional payments from the government just in 2021 as a result of these extra diagnoses or these extra codes that made their members seem sicker relative to people similar to them in traditional Medicare. So it was funny. I read like a quote from a physician that said, it's kind of crazy. If you have these Medicare patients and they go over to Medicare Advantage, which is run by these private payers, some magic wand makes them sicker all of a sudden. Well, it is crazy. They looked at comparing the coding between private Medicare, run by these private companies, and the program, and traditional Medicare, in which the government pays providers directly. And there's no financial incentive to apply certain diagnoses to physicians for patients in traditional Medicare. And this guy, he's a physician, he was one of the investigators, his name is Cronick, said that the coding differences are mainly driven by company business practices and whether or not they place a heavy emphasis on identifying more diagnoses for these Medicare Advantage patients. It's crazy. The Wall Street Journal investigation showed that this thing called upcoding, basically it's patients' doctors. They go to the doctor's office, the doctor does their evaluation, does their diagnosis, patient goes home, then the health plan sends in a nurse or someone else to the patient's home. And all of a sudden, they're getting additional diagnoses. There were even algorithms that said, you know what, if the patient has this kind of reading, they may have this illness or they may have this illness. Now, with all due respect to the insurers, they came back and said, well, you know what? We do this because sometimes the doctors don't catch everything. So we sent these nurses in there. Well, the nurses and the physicians that they interviewed in this podcast, this 3-part series, it was hilarious. First off, the nurses were like, I was called into my manager's office and said, you need to start to look at these diagnoses because you're not hitting a high enough number. And all of a sudden, she started getting bonuses when she was doing it. And then I said, well, let me look back and let's review the records. Did these patients actually get treated for these diagnoses? And the majority of them did not. So the physician's patient, the patient just knows the insurer's coming in. The physician's patient, the real physician that the patient goes to didn't know about it. And the patient getting this diagnosis, many of them weren't even treated for it. Yet these plans are making tens of billions of dollars in this upcoding. It's crazy. So in other news, Axios, which is a really good medical newsletter, reported that the Department of Health and Human Services, or as we know, HHS, identified more than $16 billion in overpayments and fraudulent billing and possible cost savings for health programs over just a half a year. Now, this spanned the end of Biden term and the Trump administration. The Inspector General for HHS said that these $16 billion are real and potential savings from October 2024 to March of this year. They identified $3.5 billion in funds due back to the federal government and more than $12 billion in potential cost savings that HHS is going to make recommended policy changes that will be able to get that money back. Lastly, another example, OIG, the Office of Inspector General, found that Medicare could have saved $7.7 billion if it had lowered payments for swing beds at critical access hospitals so that they match the same ones in a skilled nursing facility. So you have critical access hospitals billing Medicare over $7 billion more than if they would use the same type of swing beds in a skilled nursing facility. Look, you can't make this shit up. There are finally a microscope is being put down on these bad players. So let's wrap this up. And this is great. I don't know if many of y'all know, I follow legislation all over the place. I used to work on state legislation. I got so excited. Arkansas, which is a great state as far as going after PBMs and health insurance companies, they became the first state, and I think this was 2 months ago, to pass a law banning PBMs or pharmacy benefit managers from owning their own pharmacies. The reason for this lawsuit is to curb their market power and reduce drug costs. What is hilarious is that CVS and Express Scripts are now suing the state of Arkansas, claiming that this law is unconstitutional. This is great. Look, the thing is, there's a lot of recent efforts to crack down on PBMs. They're so smart. But the state of Arkansas, they actually are taking some definitive action. The investigation by the FTC saying all the bad things are done. Congress and the feds are so incompetent with all their infighting. They get nothing done. Thank God for the states. So back in April, Republican Governor Sarah Huckabee Sanders, she signed legislation that states that starting January 1 of next year, 2026, no PBMs can operate and own their own pharmacy in that state. Now, you say, well, that's crazy. Why do you want to do that? I like my CVS. Let me tell you what. This law is intended to start to check the undue influence that 3 large PBMs, CVS Caremark, Express Scripts, and Optum Rx have in our country when it comes to drugs and drug pricings. Accumulatively, they process over 80% of all prescriptions in the U.S. 3 companies. And these 3 companies have their own insurance company, have their own PBM, their own specialty pharmacy, their own retail pharmacies, their own health clinics, their own group purchasing organizations, and their own physicians. UnitedHealth Group, which has Optum Rx, they own or have a contract with over 90,000 physicians in our country. 10% of the country's physicians basically work for United. And if you don't think that United is telling them how to prescribe and what to prescribe and where to send their prescriptions and to use their pharmacies, you're not paying attention. So it's a massive conflict of interest. There have been laws out there and they just fine them. Well, these companies make hundreds of billions of dollars. It's not going to matter. They're going to do it anyway. So hats off to Arkansas, their state legislature, and working on breaking up these monopolies. Maybe the independent pharmacies, maybe they'll make a comeback if we start to pull back on some of these conglomerates. And I have to say, this was really interesting. There was an op-ed by a former representative. He was a Republican out of Pennsylvania. His name was Jim Greenwood. And it's called, "I Helped Create Medicare Advantage. Here's Why I Believe It Needs Reform." So he wrote this in, I forget the paper, but it's online if you look him up. In 2003, he helped to write the Medicare Modernization Act. This helped to establish Medicare Advantage and prescription drug benefit through Part D. And as he says, at the time, I believe that introducing the private sector and competition would spur innovation, would improve care for seniors, and save taxpayers money. I was encouraged by health insurance executives who asked me to be they would be a champion for Medicare Advantage. And you know what? I agreed with them. I believe in the promise of a system where public and private partnership could deliver better results for beneficiaries. 20 years later, he writes in his op-ed, "I have to admit, the program no longer lives up to that promise. Medicare Advantage has become something quite different from what many of us envisioned. Instead of a vibrant alternative that drives efficiency and delivers value, it has evolved into a system dominated by a handful of massive insurers who are gaming the rules for profit. These companies are not small innovators fighting to offer better care. They are corporate behemoths raking in billions of dollars by exploiting a program meant to better serve our seniors." I have to tell you, and thank you, Representative Greenwood, I have to tell you, for those of us who have been fighting this fight, these type of actions, these type of lawsuits, these laws, it's so fulfilling. And you can get involved. Look, these giant companies, they're not going to go away easily. They're going to throw money at lobbyists. They're going to throw money at politicians. But if you call your legislators, if you call the media, if you tell them your stories, if you tell them how you can't pay for your meds, how they change your medication, how what you're paying for $10 a month is now $200 a month, and you weren't given any notice, you can make a difference. You can go to my website. We're going to start a newsletter, by the way, but you can go to my website. It's got everything on there. You can click on how to reach your legislators and click on your zip code, and it'll tell you who your legislator is. I've got examples of letters that you can copy and paste. Hell, you can just type in there real quick. "Hey, Senator Joey, I can't afford my meds anymore. I'm in your district. This is ridiculous. Health insurance companies and PBMs, they are making too much money and I'm getting sick." It doesn't take much. As some of my guests, like John Hoffman, he was on one of my previous podcasts. He came out and he said, "You know what? I've been with the legislators when they walk into their office and they say, 'Hey, what's hot today?' And they'll go, 'You know what? We got 8 emails or 8 phone calls from a constituents complaining about this or this or this.' You can make a difference." And I will tell you, as he also said, if you're not part of the solution, you're part of the problem. We cannot be silent anymore. So I will end that podcast and just tell y'all, summer's here, and I'm going to do my best to keep up the weekly episodes. I am working to put together a series to help everyone increase their healthcare literacy, basically to better understand healthcare. I've talked to so many people, not just people in their 20s and teens and early 30s, but heck, some of my friends in their 50s. I'm like, Do you know what a premium is? Do you know what a deductible is? What's your out-of-pocket max, your copay, your coinsurance? And so many people don't. I'm going to be doing 15 to 20 minute podcasts, and I'm going to give you Healthcare 101. We're going to talk about health insurance, private insurance, PPO, HMO, all those different acronyms that we don't know. I'm going to walk you through it. Medicare, Medicare Advantage, Medicaid. What do your premiums mean? How much should you be paying? How can you make a difference? What if you get a surprise bill from a hospital? What should you do? How do you fight against insurers if they deny your coverage? All these things I'm going to be covering off on my future episodes coming up. I hope you listen to it. Like I said a minute ago, we're about to put a newsletter out there. Hopefully it'll be weekly. If you get a chance and it's out there, you can go to my website or you can subscribe to it. Basically, what I try to do is every day I probably read, a dozen to 24 articles on healthcare, and I distill it down to what's important so you don't have to. And you can get your little cheat sheet and you can look at it. I'll have a little quip in there is what I think is important. And then if you want to go to the article, you can click on the link. But that being said, thank you so much for tuning in. Have a great day. Help me to keep fighting the fight. God bless. Have a great summer. Peace out.